Lemtrada is a medication that is available for the treatment of relapsing forms of multiple sclerosis. It came about after different scientific studies demonstrated its efficacy and determined the side effect profile of the medication. Now, the drug as such, which is known as alemtuzumab, was available in the United States since 2001 under the name of Campath for the treatment of a different condition, a blood disorder called leukemia. Lemtrada works in multiple sclerosis because it targets specific cells that we believe are involved in creating the disease process that causes the manifestations of multiple sclerosis. MS is a condition where your immune system, your defense mechanisms, misrecognize a portion of your own body as something that is foreign and needs to be attacked and destroyed. That target of the attack is called myelin. There are cells in the blood, part of the white cells called lymphocytes, that we believe are involved in this process. Alemtuzumab, or Lemtrada, is a medication that specifically targets and destroys certain types of white cells, both T cells and B cells, that have a specific characteristic called a CD52 marking. It's like a uniform that they wear on the surface that allows the medication to target and destroy those cells.
Lemtrada was approved by the FDA in November of 2014. It's approved for people with relapsing multiple sclerosis, and in the labeling it states that it is a drug that's generally recommended for people who have had a suboptimal response to at least 2 or more of the other disease-modifying therapies for multiple sclerosis.
Lemtrada is administered as an intravenous infusion and is given in 2 cycles or courses separated by 1 year. At the beginning of the therapy, the patient would receive 5 days of intravenous infusion, and a year later, they would receive 3 days of intravenous infusion. Lemtrada is different from other medications that are available for multiple sclerosis in a lot of different aspects. If we think, for example, the route of administration, it is given intravenously, while many other medications for multiple sclerosis are given either orally or as injections through the skin, either subcutaneous or intramuscularly. In addition to that, you can also think of the mechanism of action. How is it that it works to create the beneficial effects in controlling MS? It works very different from the other medications that are available. The frequency at which it is administered is also different. While most other medications are taken either daily or with certain high frequency during the week or a month, then Lemtrada is only given as 2 cycles separated by a full year. In order to look at the efficacy, we have to determine certain outcomes. We need to look at what is it that we want to affect in the disease process. It is simple to think about other diseases, say for example headaches. If you want to bring a medication that will control headaches, you will have to evaluate how much we reduce the frequency or the severity of headaches. That would be an outcome. In multiple sclerosis, we also determine certain outcomes in these studies to see if the medication works. And usually we use 3 different types of outcomes. We're going to look at the reduction of the frequency of relapses or exacerbations or flare-ups, which are the manifestations of inflammation taking place in the brain or the spinal cord. The second thing that we look for is the progression of disability. And the third thing is the manifestations in the MRI, either the presence of new lesions or plaques that we see in the brain, or the presence of actively inflamed lesions in the MRI. So the studies that looked at Lemtrada evaluated those 3 aspects. And they compared Lemtrada to another medication also approved and effective for the treatment of multiple sclerosis. When we do studies, we need to compare the medication that we're investigating with something else to see if it is equal or superior to something different. As we have developed more and more available therapies for multiple sclerosis, it has become common practice to not only compare against placebo, or instead of comparing with placebo, to compare the active study drug with an active medication that is already approved for the treatment of multiple sclerosis, and see how it fares in comparison with that one medication. In the case of Lemtrada, it was compared to interferon beta 1A, administered subcutaneously 3 times a week. And it proved to be more effective than that compound in all 3 different parameters that were studied. There were actually two different studies performed. One study took patients that had never been on any other medication for multiple sclerosis, and the second study actually took patients that had had disease for a longer period of time and that had failed treatment with other medications. The outcomes were similar for both of those studies. What we were looking for was pretty much the same. The most common outcome that we use in studies in MS is the frequency at which patients have relapses, what is called the annualized relapse rate. When Lemtrada was evaluated against this other medication, it was determined that the reduction of the relapse rate in the first study was 49%, and the reduction of the relapse rate in the second study in patients that had failed other therapies was actually 55%. Every medication can potentially have side effects. We need to look at efficacy, we need to look at the safety profile, and we need to look at the tolerability, mainly the side effects that the drug might have. With Lemtrada, we need to talk about the potential side effects during the infusion and also the potential safety issues that we need to monitor for long term. As it pertains to the infusion itself, it is very common for patients receiving the intravenous administration of the drug to have some sort of reaction during the administration of the medication. It can be of a lot of different types, from chills and rigors and muscle aches and headaches to a more significant allergic reaction to the drug. Approximately 70% or so of patients will have some sort of reaction during the infusion, but only 3% of them will have a serious reaction, so we need to put that in context. Now, since we know that this is something that will commonly happen, we take measures to minimize that. So the patients will take medications prior to the administration of the drug to minimize the effect that might be present. As it pertains to safety, then the studies have determined that there are certain things that can happen to patients that take Lemtrada. So the three things that we need to look for is the potential development of other autoimmune conditions, development of infections, and development of malignancies or cancers. Now, the one that is perhaps of more concern because it happens more often is the development of other autoimmune diseases. Autoimmune disease just means that, again, your immune system targets something that belongs to your body and attacks that specific organ. The most common autoimmune disease that is induced by the use of Lemtrada is thyroid disorders. Up to a third of patients can develop some sort of thyroid problem. Either the thyroid gland will overact or underact, and that certainly can give patients a different type of symptoms. Now, we have a system in place to monitor for the development of those. The second type of potential side effect that needs to be monitored for is the presence of infections. And there are certain types of infections that we have greater concern for, and actually we proactively will put patients on medications to reduce the risk of that happening. For example, herpetic infections, to include herpes simplex and shingles, can be present at a higher rate in patients that take Lemtrada, so we're going to ask them to prophylactically take an antiviral for a certain amount of time to minimize the possibility of that happening. The third concern is the potential development of malignancies or cancers. And those can include cancers of the thyroid, cancers of the skin like melanoma, and other type of cancers that include the lymphoid tissues called lymphomas.
Lemtrada has a very powerful effect on the immune system, which is good news in multiple sclerosis because that's how it works in reducing MS activity. But its powerful effect on the immune system can also have negative consequences. It can produce unwanted other autoimmune illnesses. It can provoke infections. It can provoke thyroid problems. And because of this, monitoring needs to take place before someone starts Lemtrada, but also at very specific intervals after the infusion. It's very important that people know that this follow-up monitoring is critical to their overall health once they've received this medication. So prior to starting Lemtrada, one needs to make sure that there's immunity to varicella zoster, which is the chickenpox virus. And so a simple blood test can determine if someone has had a previous exposure. If there is not a titer of this antibody, then someone would need to be vaccinated, and that would need to take place at least 6 weeks prior to initiating Lemtrada. In addition to the blood tests that are needed before someone starts Lemtrada, a urinalysis is also necessary because we, again, want to monitor kidney function. So we need a baseline. Once someone has received Lemtrada, many of these tests need to be repeated at specific intervals for a long period of time. For instance, the complete blood count and chemistry and urinalysis need to be repeated monthly for 48 months following the last infusion in year 2. Thyroid function needs to be measured every 3 months for 48 months after the last infusion.
In addition to the blood tests and the urine tests that we do on a regular basis, we also recommend our patients to have an annual skin exam by a dermatologist. The reason being is there is an increased risk for skin malignancies, such as melanoma, and being again proactive in identifying these early on when they can be easily treated is the best approach.
It's important to note that there should be no live virus vaccines given after the infusion of Lemtrada. And at this point in time, that's considered indefinite. We don't have a cutoff period where it's now safe to give that live virus vaccine. So at this point in time, no live virus vaccine should be given following the infusion of Lemtrada. And actually, we don't recommend live virus vaccines in MS anyway, because it may stimulate immune system activity that could worsen MS. In the case of Lemtrada, we want to make sure that someone is able to mount an immune response, and if we give live virus vaccine, they may actually develop the condition that we're trying to prevent from happening.
Lemtrada is considered to be a pregnancy category C medication. That means that no large, well-conducted studies have been conducted in individuals that are pregnant to determine what is the effect of the drug. So the recommendation is not to become pregnant during the infusions, of course, and also to wait at least 4 months after you receive an infusion before you attempt to become pregnant. Even though the issue of pregnancy is more relevant for females, it is also advisable for males that are considering to father a child to refrain from doing so for a certain amount of time after they receive the infusion of Lemtrada.
The approval of Lemtrada brought the number of treatments for multiple sclerosis to 12, which is fantastic. But on the other hand, it can be remarkably confusing and overwhelming when someone's faced with the decision-making of which of these medications should I be on? What's my best choice? What's the best medication for me? And these are very difficult questions to answer. There's not hard, fast answers. There are best medications for an individual, but there's nothing that we have that can predict who's going to do best on which of these medications. So the best information is to have a very in-depth conversation with your MS provider about the different medications, how they're administered, what their benefits are, what the risks are, the side effects, how side effects are managed, and then what kinds of monitoring is necessary once you've had the medication. Do you have to have periodic monitoring for safety reasons? All of these aspects of disease-modifying therapies become important to that decision-making process.
For some medications that we use in multiple sclerosis, we recommend a washout period when you transition from one medication to another. There are no specific recommendations in Lemtrada. Things that can delay that, for example, can include identifying patients that do not have defenses against the varicella zoster, the shingles virus, and they will need to be vaccinated before we put them on medication.
So the cost of Lemtrada is a little bit different than some of the other medications because of how it's given. This is a medication that's given for 5 consecutive days by IV infusion in year 1, and then in year 2 for 3 consecutive days of IV infusion, rather than the other medications that may be given once a day, once a week, once a month, and so forth. So the pricing of the drug is much different. It is about $100,000 for the first year and just under $60,000 for year 2. But that may be all the person ever needs of this medication. So it sounds a very high price. It is being covered by insurers, but it's important to know that there are steps that insurers will follow for the approval of this or any other disease-modifying therapy. There will need to be a prior authorization done before someone can have a treatment such as Lemtrada. And that's true of the other disease-modifying therapies as well. Insurance companies do have rules that they follow on how they approve certain medications, and Lemtrada is no different than the others in that regard. There are assistance programs available through the drug company to help offset copays and also to help offset the cost of the drug.
We need this to be an open dialogue. We have to have a very good relationship between the patient, his or her caregivers and family members, and the healthcare system, primarily their neurologist, so that we all benefit from these approaches, so that we can really get the best out of them and provide the best care possible.